Chapter 9. Panchakarma, the 5 cleansing and purification techniques of Ayurveda. The body must be credited with an immense fund of know-how. Deepak Chopra. In cases where an imbalance has already taken its full course and symptoms of diseases are already present, Ayurveda recommends the practice of Panchakarma. This is a method of cleansing one's physical body, emotions, and soul as to not aggravate further the imbalance of the doshas. A number of ailments such as excess mucus, bloating, bile in the intestines, etc. may be addressed through the Panchakarma. However, one must be reminded of the following when practicing the cleansing method. Panchakarma is a powerful technique. Pregnant mothers are not recommended to practice it. One has to be sure that he is not weak physically when engaging in this technique. When anemic or feverish, the technique is not recommended. The practice of Panchakarma may also unleash deep-seated negative emotions. If this happens, one may rest for a while and drink tranquility tea to regain balance. 5 basic processes. 1. Vomiting. Therapeutic vomiting is recommended if one is experiencing congestion in the lungs, such as asthma, colds, bronchitis, or cough. The process involves drinking 3 to 4 cups of licorice or calamus tea and the stimulation of vomiting through the rubbing of one's tongue. Another technique is for one to drink 2 glasses of salt water in the morning to aggravate the kapha and induce vomiting. After vomiting, once the mucus is released, one is sure to experience relief. 2. Purgatives or laxatives. When there is too much bile in the intestines, liver or gallbladder, one may experience skin inflammation, allergies, dermatitis, and even fever. In Panchakarma, one is recommended to drink laxative teas, such as senna leaves or hot milk with 2 tablespoons of ghee. It is important to note that when using purgatives, one is to make sure to take it at nighttime and make sure that his diet does not aggravate his doshas. However, this procedure is not recommended for those who have poor agni, with bleeding from the rectum or lung cavities. 3. Medicated enemas. This process involves the introduction of medicinal mixtures inside the body, such as oil or herbal concoctions through the rectum. The ailments that are covered by this procedure are kidney stones, chronic fever, hyperacidity, colds, constipation, and heart pain. Also included are most vata diseases like gout, arthritis, and rheumatism. However, it is important to note that this procedure is not recommended if one is experiencing bleeding from the rectum or has a very weak agni. 4. Nasal administration of medication. This procedure aims to remove excess accumulation of the bodily humors through the nearest opening, which is the throat. It is important to note that the nose, in Ayurveda, is considered a door to the brains, or one's consciousness, and with that, it is believed that it is through the nose that life energy enters the body. The ailments that are covered in this procedure include sinus congestion, migraine, ear problems, and convulsions. However, pregnant women, intoxicated individuals, women with menstruation are not recommended to practice this technique. 5. Purification of the blood. The elimination of toxins that accumulate in the blood is integral to maintain one's health. Thus, the process of bloodletting is recommended. Toxins are absorbed into the bloodstream through one's gastrointestinal tract and are circulated in the entire body, thus creating a number of diseases. Chronic acne, scabies, rashes, urticaria, eczema, and hives are symptoms that toxins are being accumulated in the blood. However, the practice of bloodletting is not recommended for the very young and old individuals.